Welcome, everyone. Hello, hello. Appreciate everyone joining today. This is our program advisory committee within the Commission for Behavioral Health. Um, just wanted to thank everyone for joining us. I'm Dr. Gary Tsai, serving as chair of this committee and joined by Commissioner Madrigal-Weiss as co-chair. Um, we know your time is important. We appreciate everyone joining today. Look forward to a thoughtful and forward-looking discussion on strategies to strengthen the Commission's work, particularly around research, evaluation, and programmatic efforts. I also just want to take a quick moment because I've been out for a little while to thank co-chair Madrigal-Weiss as well as the CBH team for your coverage. I have felt bad while I've been out. You guys have done a fantastic job and just really appreciate um, us being able to continue to move forward in my absence. All right. So now we'll take roll, establish a quorum. Also want to just highlight that under Bagley-Keene Open Meetings Act rules, committee members who are participating remotely, just a reminder, should or actually must keep their camera on at all times, and will be asked during the call to disclose if they have any other adults 18 or over in the room with them during the meeting, as well as the nature of their relationship with those individuals. So with that, Sandra?
Great. Good morning, everybody. Please, if you're joining us online, you're a committee member, please unmute your lines now to make the roll call process a little bit easier. Thank you. And please identify if you are accompanied by someone over the age of 18 in the room with you. Commissioner Baer, marking absent. Commissioner Burnick, marking absent. Commissioner Chambers, marking absent. Commissioner Cross,
I'm here, and there's nobody in the room.
Commissioner Fernandez.
Here, no one in the room.
Thank you. Commissioner Swartz.
I'm here. Right now, there's no one in the room, but it's possible I could be interrupted by my husband's caregiver from time to time.
Okay, thank you. Commissioner Tsai.
Here, and no one here in the room.
Vice Chair Madrigal-Weiss.
Here.
We have quorum.
Great, thank you, Sandra. Okay, moving on to agenda item 2, announcements and updates. We do have quite a number of announcement updates. As a reminder for those who have joined us before and for those who are new, this will be new, but we are abiding by Bagley-Keene Open Meetings Act requirements for these meetings. But as part of our commitment to deeper public involvement, we do plan on proceeding with relaxed Robert's Rules of Order to allow for more flexible engagement with the community as well as public dialogue. We've done this for our prior meetings, so this isn't different from our prior meetings, but for those who are new, it may feel different than some of your other Bagley-Keene meetings. This new format goes beyond traditional public comment by allowing for more open conversation and space. We won't have strict, for example, 2-minute time limits. We do ask people to be respectful of time, given that there's a lot of folks here. And so we do ask that you try to keep your comments as succinct as possible. This change really fulfills a commitment made by the Commission Chair, Alvarez, to strengthen transparency and create more accessible bidirectional communication between the committee as well as the public. Whether you're here to raise a concern, share a perspective, suggest solutions, we do want folks to feel heard, valued, and part of this process. That is really a key aim of our committees, not just this committee, but also other commission committees. So a couple updates. This month, we have 6 contracts and amendments to report. The first is an agreement in the amount of $50,580 with the California Military Department that's been approved to conduct an independent security assessment for IT security as required by Government Code 11549.3. There's also an agreement in the amount of $48,677 with S&P Technology Solutions. This has been approved to acquire and deploy Cornerstone, which is a learning management software platform that will support training for both commissioners as well as commission staff. The third agreement is in the amount of $65,000 with One Mind at Work, which has been approved to plan, conduct, and report on a statewide convening of leaders from across California. The goal of that convening is to shape a comprehensive program focused on supporting workforce mental health. For the One Mind contract, additional context. Let's see here. Just some additional context on the One Mind contract. The previous contract was written in 2023. So this is actually kind of looking back to a prior contract that expired before convening and post-convening report could be completed. The contract was meant to provide an avenue to accelerate and implement the 5 voluntary standards for workplace mental health as outlined in the Commission's Working Well report. The convening was scheduled for January, or is scheduled for January 2026, and a new contract is necessary in order to provide payment to the contractor for this work. Co-chair Madrigal Weiss, I know you were part of this process. I don't know if there's anything on this that you wanted to highlight further.
Thank you, Chair. No, I just think this is just part of the commitment that the Commission had to really lift up these voluntary workplace standards. So I'm glad to see it coming full circle. So thank you for letting me add that.
Okay, fantastic. And then the fourth agreement is in the amount of $25,000 with the California School-Based Health Alliance, which has been approved to fund scholarships for the 2026 Annual School Health and Behavioral Health Conference. The fifth agreement is in the amount of $175,000 with UC San Francisco, which has been approved as part of an interagency agreement to support full service partnership evaluation. And then lastly, an agreement in the amount of $96,250 with Leading Resources, Inc. has been approved to facilitate an update to the Commission's strategic plan. And then the final update, I believe, is that the full Commission is going to have a 2-day meeting in January, on January 22nd, as well as 23rd in Sacramento. So mark your calendars if you're interested in participating in the full Commission meeting. This is the extent of our announcement this morning. I want to just thank everyone again for coming. And I think we're ready to go to agenda item 3, general public comment. As a reminder, this is reserved for comments on items that are not on the agenda. Claire, I think you're going to lead us.
Thank you, Chair. If you'd like live meeting transcription or closed captioning, please activate the closed captioning feature located in the control bar at the top or bottom of your screen. If there are any members of the public using translation technology, please notify the chair so that we can be mindful of that. You may request to make public comment by submitting a card if you are in the room, by clicking the raise hand icon on your computer or on the app, or if you're calling in by phone, push *9. Members of the public can also email us public comment to be shared at a future meeting at publiccomment@bhsoac.ca.gov. I see one comment virtually. Before we take that comment, I will go over public comment procedures. For members of the public in the room, if you have not already, please use one of the green public comment cards located at the front to indicate you would like to make a comment on this item or any other agenda items. Cards can be given to staff located at the front table. When it is your turn to comment, I will call you to the podium or unmute your line and announce your name or the last 3 digits of your telephone number. Members of the public should be prepared to complete their comments within 2 or 3 minutes or less, depending on our time constraints. And we truly appreciate your understanding with this process. I don't see any comments in the room. We will now hear virtual comments. We currently have 3 virtual comments. Our first commenter is Stacy Hiramoto. Stacy, go ahead.
Thank you. And good morning, commissioners, and welcome back, Commissioner Tsai. It's nice to see everyone. This is just a question. I appreciate the attempt to open up communication, and I am just asking a question. I was at a committee meeting recently where during public comment, I asked a question, or I felt like I was asking a question, and instead of getting any answer, I was just thanked for my comments. And I don't expect the commissioners or the staff to have ready answers to all of our questions, but if we ask a question and people don't know, I was hoping that either the staff or the commission could just at least say, well, we'll answer that later, or something, and not just go, okay, thank you, next. Because when people, again, we were not happy that people from the public were not put on these committees because we feel like dialogue was stifled. So you gave us public comment period, but if all we are able to do is to ask questions and then we're just thanked, it's not a dialogue. But anyway, I just wanted to say that, but thank you. I think these are just kinks getting worked out, and I really appreciate the staff and the commissioners' efforts to do that. Thank you.
And actually, if I could just respond to that, kind of demonstrating the point that Stacy, I think you were making. Appreciate the feedback. I think the reason for the relaxed Robert Rules of Orders obviously is for us to have a back and forth. And so we'll certainly be mindful of that. I don't know if there's anything else the CBH team wants to highlight.
This is Brenda, Executive Director, and I'm happy to follow up and thank Stacy for the for just suggestions as we continue to refine and improve our processes. So.
Thanks.
Thank you, everyone. Our next remote comment is from Gabrielle Baldinucci. Please unmute your line. Thank you.
Hello, everyone. Commissioners, thank you. I'm the CEO of Urban Vision Alliance, a nonprofit based in San Francisco. We recently organized a delegation of over 60 Bay Area leaders from many of the mayor's offices in the Bay Area to tour several large-scale homelessness facilities in Texas, Austin, and San Antonio, partially led by the Bay Area Council as well. And we then had a meeting on the Klamath in San Francisco to discuss takeaways. There's a real opportunity to create a technology platform where citizens could see all of the different housing-related projects, and specifically an entire portfolio of behavioral health facilities that would create a feeling of transparency and visibility and significantly increase private sector participation and support and community acceptance. We're working on something related to that we think will increase the pipeline of housing for behavioral health. And we look forward to sharing it with all of you as we progress with that initiative. Thank you.
Thank you for your comment. We have one more remote comment from Fernando Pinon. Please go ahead and unmute yourself. Thank you.
Okay, thanks. Can you hear me okay?
Yes.
Great. Thank you. I appreciate it. My question was just in regards to the voluntary workplace standards for mental health and how we can participate more in that discussion.
Thank you, Fernando. It would be a lot of the information is in the report. I'm sorry, we have an echo here. We're going to figure it out.
Mute, Melissa.
Okay. Fernando, there's a report, and you can find the report that the commission generated on our website. And that report does highlight those voluntary workplace standards. So if you want to take a look at that, please do. And then I would refer you back to commission staff that could walk you through any additional questions you might have.
Okay, great. Thank you very much.
Of course.
Thank you, everyone. There are no more public comments at this time.
Great. Thank you, Claire. Thank you, everyone, for your comments. I And so I think we're on agenda item 4, which is review of minutes from the PAC meeting from September 18th. At this time, I'd like to invite committee members to offer comments or ask questions. Any committee members? And also, I want to note, Sandra, I believe Commissioner Bear may have joined.
Commissioner Bear, okay. Commissioner Bear,
And I also joined too, Commissioner Chambers. I don't know.
Commissioner Chambers. Thank you. We'll recognize the chairs recognizing both of you. Thank you. And then can you, Commissioner Chambers, anybody over the age of 18 in the room with you?
No, I'm alone.
Commissioner Bear, anybody over the age of 18 over the room with you?
I'm alone.
Great, thank you.
Great, thank you, everyone. Okay, so review of minutes from the September 18th PAC meeting for committee members first. Any comments, questions? If not, we'll open it up for public comment and dialogue. Claire, take it away.
Yep, I see no comments either in the room or online.
Okay, great. Sandra, we'll take votes on the minutes.
We need a motion and a second to approve the minutes.
I motion that we approve the minutes.
Thank you, Commissioner Madrigal-Weiss. Do we have a second?
I second.
Who was that? I'm sorry.
Cross.
Okay, Cross. Thank you so much, Commissioner Cross. We have a motion and a second. Commissioner Bear.
Yeah, agree. Sorry.
Commissioner Burnick. Marking absent. Commissioner Chambers.
Yes.
Commissioner Cross.
Yes.
Commissioner Fernandez.
Yes.
Commissioner Swartz.
Yes.
Commissioner Sai.
Aye.
Commissioner Madrigal-Weiss.
Approve.
Thank you. Motion passes. Minutes are approved.
Thank you, Sandra. All right, so moving on to agenda item 5. So we do have a number of actions today, so we'll try to be as efficient as possible. This is an update on the status of the upcoming release of the RFP process for the Innovation Partnership Fund, or IPF. I'd like to invite Callie Clark, who's CBH's a research supervisor of research evaluation and program operations, to give this update. Thank you, Callie.
Thank you so much. So I do want to say, first of all, thank you to everyone to being committed to this process and helping us move forward and ensure that we can release this RFP on time in January, which will help us get funds distributed as quickly as possible to those who are applying. I'm going to take you through some of the feedback we've received from our community partners on the RFP, and then have some questions for you all where you can weigh in at the end, hopefully, and provide us some guidance as we move forward. So just as a recap, to remind everyone, we did extensive engagement efforts when we were crafting the framework, and then we took our learnings from those engagement efforts and really worked to draw an outline of this RFP that we think reflect those efforts. So we did call for concepts. We did multiple listening sessions, including one focused on individuals with lived experience. We held 3 PAC meetings. We did a CFC meeting as well, 3 full commission meetings, and we shared our framework with other state agency partners. And then we also did our own internal analysis of BHSA statute, and all of that went into the framework that was passed most recently on November 20th. We do plan to release the RFP this winter, hopefully by January. So the RFP outline that you're going to see today, we're going to bring to you some components that we're strongly considering to include in that RFP. This process is open for everyone to weigh in on any of those components that you would like. The RFP is not written yet. That's why we're here. So please feel free to share any of your feedback with anything that's being shared today. We are suggesting that there be 3 mandatory components to the RFP, and these are pulled directly from the framework that was passed November 20th. But these 3 mandatory components would be that all applicants must meet the definition of innovation as it's spelled out in the framework, address the needs of target populations also as specified in the framework, And then lastly, apply to and support county programs. Then we have 5 areas, 5 components that we would like to require all applicants to convey information to us on. And those 5 areas are how they plan to increase equity, reduce disparities, and ensure innovative projects serve underserved populations and those most in need. How they plan to involve community input and lived experience in the project design, implementation, and evaluation. How they plan to be financially sustainable beyond the life of the grant. How they plan to leverage data to identify what's working and what to improve. And then lastly, how their proposal aligns with statewide behavioral health transformation efforts. Next, we have 3 areas that we would like all applicants to identify or highlight or flag for us if they are including in their project. One is to please let us know if they are including community-centered solutions such as CDAPs, whether they're leveraging emerging technologies, and how they are advancing effective treatment models. So that brings us to 3 large buckets. The way the RFP in concept right now, it would have the mandatory components that all applicants must meet. Then there would be components that all applicants must speak to in their application. And then we would have 3 areas where we would like them to flag for us or highlight for us if they are focusing on these areas. I'm going to take you through briefly the feedback that we've received on what we're calling the nuts and bolts of the RFP. This is really aspects that go into the details of the RFP. And we have received a lot of feedback. And I'll tell you what our planned response is to each of those. Now, you will see a term in here or a phrase in here, under consideration for inclusion. So you will not notice the phrase, we are including that in the RFP. And the reason why you won't see that phrase is because we are bringing this to you all to get your feedback. So no decisions at this point are final, and so you will see under consideration for inclusion. If you see that phrase, it means we are strongly considering that for the RFP. If you have feedback, please give it, but that we are strongly considering that. So we receive feedback that proposed project must not duplicate existing efforts. That's under consideration. We agree that the CBS must ensure no conflict of interest with commissioners. That is already addressed with the existing conflict of interest laws and waivers. And then we received mixed feedback actually on who lead entities should be for these. Should it be CBOs exclusively? Then we had feedback that it should not be CBOs exclusively. We've considered this, and what we are suggesting is a small grant tier that requires the lead grantee to be a CBO, a nonprofit, or a tribal organization. However, large grants would be open to all organizations. We receive feedback that awards should prioritize equity, lived experience, and community leadership as scoring criteria, and that is under consideration. Also, that we clarify who other populations are as determined by the CBH. That's also under consideration. We receive feedback that eligibility should not be limited to those serving individuals with a diagnosis. We agree. This is addressed in the definition of indicated prevention, and the BHSA eligibility does not require a diagnosis. Projects aimed at BIPOC and LGBTQ+ communities should be especially prioritized. And we believe that BIPOC and LGBTQ+ communities are encompassed in the following populations, which we are prioritizing under the IPF framework: underserved populations, low-income populations, communities impacted by other behavioral health disparities, and other populations as determined by the Commission. We receive feedback that we should use IPF funding to sustain and expand the California Reducing Disparities projects. All projects, regardless of whether they were previously California Reducing Disparities projects, that meet eligibility outlined in the IPF may apply. We receive feedback that IPF should incorporate a shared learning component so impact is maximized for the broader public. We agree, and the Commission plans to assess and document learnings, and where appropriate, publish those learnings for public knowledge. The grants should be data-driven and have clear data collection and reporting requirements. We agree, and it's under consideration. Grants should specify how investments will be measured, tracked, and evaluated to ensure goals are met. Also agree and under consideration. that funding should be tiered to meet the needs of applicants of different scales. We are considering a small grant tier that requires the lead grantee be a CBO, nonprofit entity, or tribal organization. Large grants, however, would be open to all organizations. And that we require match funding or other way to ensure outside support. While potentially a valuable recommendation, such a requirement may preclude many applicants and will not be incorporated at this time. However, sustainability will be a component considered in the RFP. So I just took you through public feedback around the nuts and bolts, and these are areas where we feel that we have a response, where we have a direction so far. We're still open to feedback, but we have a good understanding of where we might go with these. The next section, we're going to look for elements that are not yet made clear, and we're going to ask for your feedback on these. Okay, so what's still on the table? What are we still trying to figure out? Well, we need the details of should there be small grant carve out, and if so, what does that look like? Is it a specific dollar amount? Is it a number of grants? So feedback in this area would be very valued. What should there be a minimum and a maximum grant amount? How should the commission best assess potential for sustainability in the application process? So what would people submit to us so that we could assess sustainability, and what would that look like? What does success look like? And what metrics should the commission use to measure this? Remember, at the end of the 5-year period for IPF, the commission is to develop a report where we talk about the potential impact of IPF. So defining success now is fundamental. So what would that look like, and what would we be asking grantees to submit so that we can get there in 5 years? And part of that, part B to that, is how do we ensure grantees have the capability to accurately and successfully collect, track, and apply data to ensure continuous improvement from day one so that we see these grantees grow over time. And then, of course, we are always open to other considerations. Now, we are asking for the Program Advisory Committee to recommend that the full commission approve the adoption of the Innovation Partnership RFP outline as laid out before you today. And with that, I will pass back to our chair. Back to
Great. Thank
you
you.
so much.
Thank you, Claire. Do you mind going back one slide? Maybe I'm thinking we can sit on the second, this slide. Just to help inform some of our discussion, I think these are the particular areas where we're interested in thoughts, comments, potentially questions from both the PAC commissioners as well as the public. I'm going to just open it up to the commissioners first. As you saw in the next slide, there will be a vote, and so I just want to make sure that there's adequate understanding and questions are addressed. So for the commissioners first, we obviously will also open it up to public after that. For commissioners first, comments, questions?
Commissioner Sai, how do I get the slide up while it's double? Like, all I can see is you. I can see a smaller version on the host.
I think you can double click on the smaller version.
Oh, okay.
But I'm not 100%.
It's also in the attachments that were in the invite, if you want to read alongside. I had the same issue, Rachel. I couldn't open it. I couldn't make it bigger.
Yeah, because all right, I'll be able to have that conversation once I do what Brandon just instructed me to do.
Okay. Thank you.
I have a question. I have the technology issue too, but I just have a question on these grants. There's no peer learning element to connect the grantees to each other ever. I mean, or can we consider that in sharing best practices across the board?
We absolutely can consider that. That has actually been brought up. And so it is something that's under consideration. And so we would love to hear more about what you think that might look like.
Okay. I mean, it's more, capacity. I just feel like a lot of these are in silo. And if we can either bring them together, Zoom best practices, or, just the touch points on what is successful, what is not, so they can move the needle within their communities on a better, faster track, maybe.
That's a
And
fantastic.
Commissioner Bear, I think I'm following, but I just want to kind of make sure. When you say kind of peer learning, you're referring to the awardees kind of being able to have like a collaborative to learn from one another, right? Not necessarily peer specialists or anything like that.
Correct. Correct.
And so, yeah, I think that that's a great idea. To me, it also gets at, I don't know, that's the fifth bullet about how we ensure grantees have the capability to track data, et cetera, right? And so maybe we can fold that into, are you suggesting like a forum where awardees can check in every now and then?
Yes.
Yeah.
And rely on each other as a resource.
Yeah. Yeah, and there might be kind of formal and informal ways to do that.
Yeah, and
Okay.
just to Commissioner Bear's point, I think that that's one of the biggest system issues relative is that people are in silos. Like I just went to a conference with other providers from Northern California and their grantees under a commission grant. And the people are things are happening like in their programs with the health plans, and like if we can utilize these grantees to really be like our insulated way that we can also get knowledge and information that's happening on the ground. And then because I was just like shocked at what all these providers were saying that was happening. I'm like, well, where was the forum? And I'm like, well, and I was like, well, the commission, is kind of always seen, but I think that like to the commissioner's point, like we could really use this as a way to be like our power and grants to be able to say like, this is what we're hearing on the ground. Because I honestly, right now, as I'm advocating on like right now, we're implementing new laws, and there are providers in real time that are like, if we don't say something or have the right voice or have it documented, that things are like for certain providers. So, anyways, I think that's a good point, and I have the agenda, so that's not my point, but thank you for uplifting that as well.
Great. Thank you.
Brenda, real quick, I was going to pop in and see if maybe Cody might be able to help folks with the screen issue.
Yeah, so if you click on the screen, the small window of CBH host amongst the gallery there, and hit the three dots, the ellipsis there, and then go to pin, I believe that should pin that presentation bigger for you guys.
Oh, Cody, that was magic. Thank you.
Thank you, Cody.
No problem.
All right. Thank you to the Zoom Whisper, Cody. Other commissioners, suggestions, comments? Not seeing any. Shall we open it up for public comments?
Were you talking about just this slide? Because can we go to the priority, like the other slide where it had those the table that had the considerations?
Yeah, I think Claire, I think Commissioner Chambers is referring to the table with the green feedback and response. Is that what you're talking about?
Yes.
Sure, I'll ask Cody to pull that up. Thank you.
And then are these questions like, what is success? Are you asking us like, what does success look like? Or is this the things that the RFP is going to bring out?
Thank you for asking that, actually. So we are asking for feedback on what you envision success looking like in this under IPF. So what would make these grants successful? Is it specific outcomes related to or improvements in client outcomes? Is it service delivery outreach? How do we measure that? What do we ask for? At the end of the day, if we're going to tell a story about IPF and its success, what should that story look like?
And so I appreciate that. So I wonder, and this is a question to the chair, like Dr. Sai, or is he the chair, right? do we align what success looks like with the new BHSA and like as the policy as being implemented, like, and like we're trying to make innovations to that, or like, because success right now would be, I mean, just in my eyes as like a lay, person would be like working to improve immediate like gaps where in 6 months, 7, 8 months, we'll see some of how this new law, because right now we have a whole new system with integration. So, I mean, I don't know if I'm just spinning my wheels with that, but I do want to be clear because I want us to be relevant. Like, I'm really been deep in thought, like, how do we have the best impact? How do we have the best relevancy to the behavioral health system while everything is changing and shifting? And I know we have like our legacy folks that have seen this innovation fund, and I mean, a lot of things have been good, right? I'm a part of an innovations project that I've been seeing that's amazing, and the technology, and it's gonna integrate into the system. But is that the goal, right? So yeah, I'm talking, but please speak over me, Dr. Sai, or any other commissioners.
So I don't know that I don't think this is my decision, but I'll share my perspective, and I would be interested if others have perspectives. I mean, because I think your question fundamentally to me is the question that we had posed on the slide that outlined those keys, which is like, how do we define success? I think the reason why we're asking that question is because there are different ways to define it, right? From my perspective, we don't have, as long as it generally aligns with BHSA, I don't think that there's a requirement to specifically align it to different metrics or whatnot of BHSA, just because I don't think there's anything requiring that level of adherence. And also, I think that success may look different depending on what the program is focused on. Although, there should be some fundamentals that tie everything together. It's kind of my perspective. But are there other thoughts? Because I think this gets at that key bulleted question.
Commissioners, I think I'm generally in agreement with your first part of your statement, which is that if we can remain flexible in terms of what the goals need to be with still meeting some of those general overarching goals of BHSA, then I think that we've got it. I think almost inherent sort of within the IPF framework has to be some type of notion that we're it's almost exploratory in terms of the hypothesis that's being put forward, because we don't want to just fill gaps for other funding that's either drying up or is funded elsewhere. So I think that if we can remain flexible, then we should, and I hope that that's how we can get about doing this. I also think that if we place too heavy of a burden on the grantee's abilities to provide specific types of data, that you may not be able to get a broad range of different applicants, because the type of data that would be presented that's being tracked and collected is going to be distinct depending on what type of sort of plan is put forward. And so I think that needs to remain sort of artfully vague as well when we're evaluating these projects.
Yeah, thanks, Commissioner Fernandez. I do want to kind of contextualize. Well, I think that flexibility is important as well. Obviously, it does have to be within the confines of what we've talked about with IPF, right? I think that's the one kind of caveat. It wouldn't make sense to kind of measure success outside of what's actually allowable of the IPF funding. Any other thoughts on that?
I just think that, I mean, and in my response to, I don't know if I saw like anything that it says stuff that focused on CBOs, but just the emphasis that what we're hearing, and I could be incorrect, is that there's going to be, and this is not, I don't know this is what I'm hearing from constituents, that like there will be reductions in community-based mental health programming, like, and then like in the next round within, and I don't know if that's to be true, but the staff said that across multiple counties that, so how does this fund, and I'm not saying we got to be responsive to everything, but while we're planning, like if we have if we know we have a duty to be like, just at least be aware that, yeah, and if all these things are focused, and I mean, I think we need some stuff that's, a mix of technology and different things, but a lot of, I believe, of our community-based services and our community, our cultural define, our like culturally appropriate, linguistically appropriate. Like I was just talking to individuals in the Vietnamese community that does in language specific work, and they are losing money like at the health plans, like and how to bill. Like so I just want to make sure like, you know, like we protect like our community, our smaller base, cultural specific communities, and also that and then there was feedback on, could you go to the next slide, on commissioners about the box, the chart that you had in green. There were 3 slides, I think, of the square. You were presenting the first one. I think it's the second one.
Okay, just a moment.
Well, I'll look at my other slide while you're doing that.
Is it this one?
Sorry. It's the second. Well, I think it's the first one. It says, well, okay, projects. So nuts and bolts. Proposed projects must not duplicate existing efforts. CBH must ensure no conflicts with commissioners. I'd like to make sure that commissioners, like from legal, like we be transparent on what guidance we get on and how we participate and engage in these conversations, and what does that mean? Because many of us are also small CBOs, or, you know, might have conflicts because we work on boards and other things. And I'd like for us just to be more, to get more guidance amongst commissioners as we have new commissioners on what that means. And I know we just said address with existing, but I think if, what does that mean? And maybe we could talk about that at the commission meeting.
Yeah. I don't know, Sandra, if you want to kind of highlight that now. I think in general, it is, if you are applying or thinking about applying, you know, I think that's an instance where there's a potential conflict, and, you know, we would recuse that commissioner, or that commissioner should recuse themselves. Obviously, Sandra's available as a resource to address any kind of more nuanced questions. Sandra, anything else?
Absolutely. Any commissioner is always welcome to reach out to me. But the general rule is, if you are considering applying to any grant that is sponsored by the commission, that you do not participate in any of the formation discussions of the grant, because it could be seen as a conflict of interest. So they're very strict. The Political Reform Act is the governing law here, and there are very strict recusal requirements in this.
I think that sounds different from what Dr. Sai said, so a little bit different.
I intended it to be aligned with what Sandra said, so I thought it was fairly aligned, but yeah, we can address the specific questions, Commissioner Chambers.
That would be like participating in the commission meeting then, right?
Correct. Whenever the discussion is up. So, for example, participating in this meeting, if you were a commissioner, you know, influencing the direction or providing feedback on how the grant is written, or how the you know, it would present a conflict. And I mean, again, a lot of this is judgment, right? How much have you been involved? How many, you know, like it's a commissioner by commissioner, you know, have you gone on site visits? Have you, you know, written your opinion on who should not get funding? You know, like it is a case by case evaluation. So I definitely would recommend reaching out to me directly so that we can see the extent of involvement and the recommendation.
Yeah, and I think the public has reached out to me many times, and there are other people. So, like I said, I wasn't trying to call you out, Dr. Sai, but it just sounds like there's some education that the public would, and she's saying more, and then there's education on both sides, because the public is asked, and I appreciate it. I wasn't trying to be conflicting.
Yeah, no problem. Okay, I'm mindful of time. We have 8 public comments thus far. Unless there's any other burning comments or questions from the commissioners, I think we'll move on to public comment. Is that okay? All right. Claire?
Thank you. At this time, members of the public may request to make a public comment on this item. It looks like there are no comments in the room, and we have 10 comments virtually. We will start with John Alita. John, please unmute yourself. Thank you.
And do appreciate people kind of keeping your comments as succinct as possible. Thank you.
Thank you. Good morning, commissioners. I'm John Alita. I'm the executive director of the San Joaquin Pride Center and also a grantee under the CRDB project. So some comments and questions today. First of all, our group does support of course, the focus of applications being on increasing equity and reducing disparities. We would like to stress, though, that we hope there be more demonstration than simply saying someone has a commitment to diversity and sort of just stating some diversity demographics in their geography for their application to be considered. We think there should be some more clarity around kind of what exactly they are pursuing, other than some, kind of vague references. We also want to caution on we understand programs need to be seen as sustainable, but to weigh that principle too strongly, it might be more challenging for CBOs. It also seems to implicate that the approach of the program would need to become Medi-Cal eligible. And from our perspective, if it were eligible, it would already kind of have been sustainable and not necessarily needing funds. In terms of duplicating existing efforts, our CRDP cohort wants to make sure that that doesn't mean us. Our funding does sunset in June of this year of 2026. So we wouldn't necessarily want to be considered one of the existing efforts, as that would really hamper most of us from being able to be considered for some of this funding. Um, Also, we do support CBOs being the lead. We believe it's more difficult. At least particularly, we know that in our county, for our governmental agencies to always kind of be the leads in this way. They do not necessarily have the cultural understanding or the kind of more nimble infrastructure that our CBOs do in order to provide services. We also strongly support the feedback comment that awards should prioritize equity and lived experience. In terms of the specific language calling out BIPOC and LGBTQ communities, while it is true that those are subsumed under the other sections, because they are such important communities and in need of such services, we believe that they should be called out specifically as part of the language in the RFP. And then under the last box on slide 9 about using the funding to sustain and expand CRDP, we do not suggest that other projects should not be eligible. We just want to make sure that all projects that need funding get it. But we also want to be, I think you all know at this point the history of this project and how successful it's been, and we really do feel that what we're contributing can continue under the kind of new way that IPF is being implemented. So thank you. That's all I have to say.
Thank you. Next comment is Fernando Pinon. Thank you.
I'm sure. Thanks. I just wanted to touch on the point about data control, and maybe a useful model you could look to is NASA's Citizen Scientist Program. They also have a program called TRISH, and through that they use all of the different commercial aerospace providers, but it's all data managed under NASA so that it can go across groups and everyone can have the same quality control mechanism.
Thank you. Next comment is from Kiran Sahota. Thank you.
Good morning. Thank you, commissioners. My name is Karen Sahota. I am a former county employee. I ran MHSA in a large county and was also part of the original innovations framework a decade ago. So I'm really excited about innovations. Innovations, since I've retired, has still been a big part of my life. And excuse me, as I look down at all my notes, as I've been writing notes this whole time, but a couple things I'd like you to hopefully keep in mind as you look at this framework is I hope you don't X out the idea of expanded innovations. Just because innovations works in one area, we may want to still innovate in other areas to make sure that it can be successful across the board. And so I hope that you will consider expanded innovation efforts. I keep hearing the words story and success, story and success. And I just want to make sure that we're not looking at scripted innovations, because then that's not innovations. When you are scripting it, it becomes programming. And so I'm really hoping that that the parameters towards innovations do not detract from true innovations, and that success sometimes is failure, and that sometimes we do have to try new and innovative ideas, but they may not work, or they may not work with a particular population. So I think we need to be mindful of what success looks like. And it could be, hey, success is we realized that it works better with this population versus that population. And that failure isn't necessarily a waste of funding. And that's what everyone tends to look at, is that if it's not successful and able to be replicated, then it was a waste of funding, and that's not always the case. So I hope we also look at success could be failure, but it's learning, that's innovations. And then the other one aspect that I really wanted to talk about was to kind of tie on to what Commissioner Bear was saying, is that of learning communities. I agree wholeheartedly. And an innovation program I'm currently working on, we meet every 6 months with 8 counties, and we talk through challenges. We talk through success. We talk through what worked for one county that may not work for another county. So I'm highly recommending some sort of learning community. And I really think that's been lacking in all the years of MHSA/BHSA, is that of the learning communities. How to work with counties, how do CBOs fit into counties, and how does it look when you're working at cross county agencies. So really learning from that, because what a small county does could actually impact a large county, and what a CBO does in one county could impact CBOs in another county. And I really hope that you look at that learning community from the BHSA, CBH, actually from the CBH standpoint, and really running something to allow participants to really learn off of each other. And that's all I have. Thank you for your time.
Thank you, Karen. Sorry, just to step in real quick. Just looking at the fact that we have more speakers now than when we began public comment, and we have about an hour and 5 minutes. I'm a little bit concerned about time. I would like to avoid a strict time limit, but I do want to ask people to please try to keep your comments as succinct as possible, because otherwise I don't know that we're going to be able to get through our full agenda. I don't know if the CBH team kind of has any suggestions for a different approach, but maybe we'll give this one more go, and then otherwise.
The possibility is, the options are that you can limit public comments to a minute each, 2 minutes each. You can make the decision to see if we can keep that pace, but that is a decision the chair can make.
All right. So for now, I'm going to be soft, and let's just try to keep it to a minute. If we can't, then we'll do something a bit more firm. Thank you, everyone.
And quick question, how many hands do we have raised still?
We have 10 hands.
Oh, 10 hands. Okay.
Eva Lay, I'd like to ask you to unmute yourself. Thank you.
Thank you. Aba Laye, President of Whole Systems Learning. And I want to speak to the second slide in the framework: increase equity, reduce disparities, and ensure innovation projects serve underserved populations and those most in need. And I want to juxtapose that against the second feedback that talked about prioritizing BIPOC and LGBTQ. So the answer to that spoke about other populations as determined by CBH, which we don't know who they are. Communities impacted by other behavioral health disparities, we don't really know what that means. Low income populations, which isn't something that has been specifically addressed in the in prior programs. So we're really just dealing, it seems to me, we're really just dealing with underserved populations. Now, if we're not, then I'm sorry, we really only, yes, if we're not really dealing only with underserved populations, then we are not really addressing the need to increase equities and reduce disparities. So I think that the increased equities, reduced disparities requirement should apply to underserved populations specifically, even if that is only prioritized in the scoring. I think that there's a need to prioritize it. The other thing is that if populations are going to say they're underserved, then in order to adequately increase equity, there should be some statistical evidence of that a population is being underserved, and a population should be called out. Thank you.
Thank you. You know what? We have 10 hands. Let's just put the minute on, just so that people can have that Academy Awards kind of tick down effect.
Can I just ask one question? Is this a dialogue where there's going, or are we just making the public comment?
It's mainly a public comment. We're able to dialogue, but I think given time, I mean, I think we're mindful of how deep we're able to go. But we've taken your feedback.
I was going to say, Commissioner Tsai, is, we only have so much time, but we can accept written public comments and would be great if folks could get it to us by December 31st. So how about that be a way that we can make sure that we're capturing everybody's thinking, so that, really the goal here is to try to have the thinking of everybody here today to help inform how we craft this RFP. And so if folks have ideas, then we would be, we definitely want to capture those. So if we can't get it today in a verbal, it'd be fantastic if folks can do a written by December 31st. And Callie, I don't know if you have anything to...
No, just written is great, because then I have it in front of me when we're making decisions. So it's actually quite lovely to have that. Thank you.
And then I was just going to say, too, is just to remind everybody that the IPF framework was already approved by the Commission in our November meeting. So we're really just, again, focusing on trying to get ideas for the RFP development.
Yeah, thank you. Great idea, Brenda. Maybe we could focus on the slide, the second to last slide that focuses on the new things, just to highlight the table with green. That's basically a summary of feedback that we've previously heard, and then some of our response, right? And so I think to avoid kind of reiterating what we've gone through previously. Thank you.
Thank you. We're working on getting the timer up, but I'm going to move to the next comment from Regina Mason. Please unmute yourself. Thank you.
Okay, great. I'm unmuted. Can you hear me?
Yes.
Yes. Okay, great. Thanks for giving me the opportunity to speak this morning. And I'm Regina Mason. I'm the co-founder of the Village Project. Our organization came to fruition to meet the unmet needs of the African American community in Monterey County through Proposition 63. And now that that's gone away, we're doing innovative things to sustain services, mental health services to our population of unserved, inappropriately served, and underserved members of our community, which we see on a daily basis. I was prepared to talk about the nuts and bolts, but in the interest of time, and you put that slide up around areas that you want it to cover. So I will give public comment on what I originally came to talk about in writing. But I want to make sure that the tier system that you're proposing not exclude larger an organization to be able to apply for tier funding and to apply for a larger grant. That's number one. The other thing is that I don't think that CDEPs should be labeled as existing programs. And I think that we should be able, we do have a CDEP, by the way, and I think that those CDEPs should be able to get funding outside of being an existing program, because our programs were being researched at the time to look at what's working and what's not working. And then when it comes to data collection, I really think that there needs to be some additional funding. Okay, I think that there should be some additional funding for data collection outside of the amount being awarded. Thank you. I'll put all my other stuff in writing. Thanks.
Thank you. Next comment is from Josefina Alvarado. Please unmute yourself.
Thank you so much. I'm just going to skip my introduction so I can get right to my comments. The first one is related to the question of the sustainability and the review process. And I think that there's another question for the commission. And that question is, what is the commission's role in helping to sustain the programs that are funded through the IPF? If these programs prove to be really effective, then I would think the commission would want to see them sustained and are scaled. So that's a question back. And then in terms of what does success look like, I have 3 specific suggestions. One is that an equity evaluation framework be developed to measure this. Secondarily, specific metrics related to reducing disparities need to be included and measured as part of the evaluation of this element. And then finally, all grantees should be required to disaggregate the data by race, ethnicity, LGBTQ+ status so that reductions in disparities can actually be tracked. And that is a requirement of the BHSA in the legislation. And then finally, there's a question about awards prioritizing equity, lived experience, and community leadership in the scoring criteria. And if that is going to be the case, which I wholeheartedly support, then the review process should include readers that have experience related to equity, lived experience, and community leadership. Without the
Your time is up. Please wrap up.
Without the expertise in the review process in terms of the readers, then you're not going to really be able to meaningfully assess that criteria. Thank you.
Thank you. Next comment is from Reina Vasquez. Please unmute yourself.
Good morning, commissioners, and thank you for the opportunity to provide public comment. My name is Reina Vasquez, and I am with the Village Project, which is one of the organizations of the CRDP. I also already had my notes prepared regarding the first box under feedback on slide 8, stating proposed projects must not duplicate existing efforts. So I am concerned about how existing efforts is being interpreted, particularly as it relates to CRDP IPPs. So although these programs are currently operating, their funding is set to end on June 30th, 2026, raising the question of whether their current status would classify them as existing efforts. So we would just like to ask for clarity that such programs are not automatically disqualified simply because they are operating today. And that's all I have for now. Thank you.
Okay, I just do want to clarify because this has come up a few times. No program would be automatically disqualified. What we were talking about are parallel programs that would happen over the life of the grant. So that's what we're talking about, existing efforts. So just to clarify that.
Thank you.
Thank you. Next comment is from Gabriel Baldanucci.
Thank you. On the question of what does success look like or should be considered success, I would suggest that a priority should be any innovation's ability to increase either the capacity or the effectiveness of the system in serving the population in need. And that might look like increasing resources, lowering cost, getting more support from the public sector or public engagement. Thank you.
Thank you. Next comment is from Stacy Hiramoto.
Hi, Stacy Hiramoto, Remco. In the interest of time, I will just say that I support all the comments made by John Alito and Josefina Alvarado Mena. I will send written comments, but I do want to point out one of the points on slide 8 that says the fourth feedback box says awards should prioritize equity, lived experience, and community leadership as scoring criteria. But the response box so far says under consideration. And so that's why I think some people are concerned, because it says under consideration as if those would not prioritize those things, and we want those prioritized. The other point I wanted to make was how should the commission best assess potential for sustainability? Please do not say Medi-Cal. Yes, that's the best way to sustain a program. But if the programs could be qualified for Medi-Cal already, they probably wouldn't need to be an innovation. Thank you.
Thank you. Next comment is from Laurel Ben-Hamida.
Can we
Yeah,
respond
can we
real quick?
clarify real quick? So Stacey, I do want to clarify for you that under consideration for inclusion is our way of saying we plan to do that.
Also that it's.
Oh, thank you. I thought it was, I
We-
thought it
we
meant
can't
you were
do it. Just so you-
considering.
No, just so you know, we are not making final decisions until we've heard from everyone. So that's why we purposefully are leaving room for the public to weigh in today. But it is our intention, given the feedback today, to pursue those that say under consideration.
I appreciate the clarification. Thank you.
All right. I'm Laurel Ben Hamida, Mass SSF and REMCO. How long can a project be proposed for? 1, 2, 3, 4, or 5 years? Can collaboratives and coalitions apply? And how would the tiers be handled in that situation? 3, I'd like to see some ballpark numbers on the size of the tiers, size of contracts. 4, 20% evaluations suggested. And 5, thank you, Commissioner Bear, for peer learning suggestion. Do you have any other suggestions based on your international experience with CBOs? And 6, I really think we ought to have time for discussion.
Okay.
Thank you.
Well, thank you so much. I can try to answer some of those just super briefly, but basically those much of those is still under consideration and what we are hoping to get feedback on today, including the size of the grant, et cetera. So, and coalitions, we are open to that. We have, so please consider that in your application if you feel it's appropriate.
Thank you. Next comment is from Carlene Davis.
Hi, I just wanted Carlene Davis, California Black Women's Health Project and California Reducing Disparities Project. And this goes back to the low income and eligibility. I just want to really make sure that low income eligibility does not get conflated with Medi-Cal, like under any circumstances, particularly because the asset limit has been reinstated into Medi-Cal. So there is about to be a large swath of very low income California residents who are no longer going to be eligible because they might have some assets. So please do not conflate low income with Medi-Cal. And I also do want to lift up that success does mean for CBOs and community-based organizations, 2 things, that there are community-based organizations who are doing great work who may not yet be at the stage that they have audited financials. So I would not want audited financials to be an exclusionary point. And then also to make sure that the funding opportunities allow time for planning, which would be multi-year.
Thank you. So we have 3 more public comments, I believe. I think Lueni will be the last public comment. CBH team, if we could get the 1 minute on the screen, please. Thank you.
Thank you. The next comment is from Vaughn Simmons.
Good morning. My name is Vaughn Simmons. I'm with the California Black Women's Health Project. And I just wanted to briefly comment on slide 9, the feedback regarding BIPOC and LGBTQ+ being part of, I guess the response rather, being part of this kind of umbrella term of underserved, low income, communities impacted by behavioral health disparities. I really want to just kind of call and encourage us to maybe reconsider that, because having this umbrella term may feel very safe, but it also does not necessarily address specific needs of those groups because they're being lumped together with other groups. So I just wanted to mention that and thought that was important to share. And thank you so much for your time.
Thank you. Last comment is from Luani Messina. Thank you.
Thank you. Good morning, commissioners. My name is Lueni Masina, and I represent the Sensamana program, a program funded under the California Reducing Disparities Project and only CDEP serving Pacific Islander communities, one of many communities that are often unserved and underserved. As I comment in support requiring projects to increase equity, I also humbly urge the Commission to evaluate proposals based on real actionable plans, not just language. Like many who have gone before me, I strongly support prioritizing community-based organizations and adopting equity by honoring lived experience and community leadership. And so in closing, as the CRDP approaches its sunset, we urge the Commission to recognize the proven success in improving outcomes and reducing costs for BIPOC and LGBTQ plus communities. These programs reflect what innovation funding is meant to support and should be carried forward. Thank you for your time.
Great. Well, thank you everyone for your public comments. Thank you, Callie, for walking us through that, as well as Claire for managing the public comments. Let's move to roll call vote for the PAC to recommend potentially moving this forward to the full commission. Just a reminder, we're advisory in nature. So per Bagley-Keene, we can't take official action. So this vote is not an actual motion, but more of a symbolic agreement that we that the PAC collectively supports using this framework. And so with that, I'd entertain the PAC committee's recommendation on the screen here. Do I have a, I forgot what it's called.
Motion?
Motion? Yeah, that's not quite a motion.
Yeah, yes, symbolic motion. Do we have a symbolic motion?
I'd make a symbolic motion to approve the framework as proposed.
Thank you, Commissioner. Is that Fernandez? And who seconded?
I did. Madrigal Weiss.
Madrigal Weiss. Thank you so much. We have a symbolic motion and a second. I will now call roll. I'm asking all commissioners to unmute themselves to make this roll call a little bit smoother. Commissioner Bayer.
Aye.
Commissioner Burnick. Absent. Commissioner Chambers. Marking absent. Commissioner Cross.
Aye.
Commissioner Fernandez.
Aye.
Thank you. Commissioner Designee Swartz.
Aye.
Commissioner Sai.
Aye.
Vice Chair Madrigal Weiss.
Aye.
Symbolic motion passes. Thank you.
Great, thank you. All right. So we'll move this forward to the full commission on the upcoming release of the RFP, and I think we'll move forward to the next agenda item. Agenda item 6 is
Chair Sai.
Yep.
Thank you. At this time, I'm going to recuse myself from participating in today's discussion on the next item and any related decisions concerning the Behavioral Health Student Services Act, grants pursuant to Political Reform Act Government Code Section 87-100. My employer, the San Diego County Office of Education, currently receives BHSSA grant funding and may apply for future BHSSA grants. Involvement in decisions regarding these grants could affect the San Diego County Office of Education's financial interest and, as a result, my own economic interest as an SDCOE employee. So to prevent any potential or actual conflict of interest, I am removing myself from this agenda item. I will not participate in any discussions, deliberations, or votes related to the grants. Thank you.
Thank you, Co-Chair. All right, and so this is agenda item 6. There's a discussion and vote on detailed plan for encumbering one-time administrative and evaluation funds for the BHSSA, or the Behavioral Health Student Services Act. At this time, I'd like to invite Melissa Martin-Mollard, Deputy Director of Research, Evaluation, and Programs, for the update.
Great, thank you so much, Chair Sai. Okay, I'm gonna, in the interest of time, since we still have another agenda item, I'm gonna kind of go through the slide deck a little bit quickly. I want to make sure we have time for both public comment and discussion of our committee members. So as Commissioner Sai indicated, this item is regarding one-time funds that we have for the Behavioral Health Student Services Act. We have two buckets. One is $5.1 million in administrative funds, and the second bucket is $9.2 in evaluation funds. These one-time funds are separate from the $7.6 million that the commission will receive in an ongoing way starting in 2027. So those 7.6 are off the table for discussion today. Oops, I went the wrong way. Let me go the right way. Okay, so just to remind everyone quickly that the three components of the BHSSA include, of course, our local assistance grants. So that's $280 million to all but one county in California to support partnership development and behavioral health supports in schools. The second component is technical assistance, capacity building, and sustainability. And then the third is evaluation and learning. And we have efforts going for technical assistance and evaluation and learning. And what you'll see today in this presentation is some proposals to augment those efforts. So as I mentioned, we have 5.1 million out of our administrative funds to encumber. We've already either earmarked or encumbered the majority of the 25 million that we received as part of the BHSSA legislation. On the evaluation side, we were allocated 16.6 million for evaluation specifically, and of that 5.7 has already been allocated through our West Ed contract, and then small stipends to the local evaluators to participate in statewide efforts. For the administrative bucket, those funds currently support staff positions and contracted positions, including some of our limited term positions that are relevant to BHSSA. Those funds also support our existing technical assistance contracts and a pretty broad suite of our software and IT infrastructure. For example, our SaaS software and Tableau for data visualization. We recommend encumbering the remaining funds, and this includes both admin and evaluation, to support some additional software. So the grant management software to help support the fiscal controls and our grant monitoring activities kind of across our portfolio, of which BHSSA is the largest. Additional technical assistance in the form of statewide suicide prevention training. So our recommendation is that we amend our current contract with CARS. Third, to initiate some substance use disorder pilots for youth who are justice involved and at risk for school failure. And we're proposing that be done through a competitive procurement. And then on the evaluation side, and this is tied to the specific legislation and our mandates around evaluation and data collection, to support school behavioral health performance management systems. Okay, so I'm going to go into, oops, this didn't go forward. Okay, I'm going to go into some, sorry, I think I skipped forward one. Okay, apologies. Go into some detail around the technical assistance for suicide prevention training. So the goal of this technical assistance is to develop online suicide prevention training modules that are available at no cost to teachers, staff, parents, and students to identify, support, and refer students who may be experiencing thoughts of suicide. So we propose using the funds to add a new scope of work to our existing contract with CARS, or the Center for Applied Research Solutions. CARS are currently providing training and TA to our 57 BHSSA grantees and their partners. They've developed the relationships and would really be poised with a contract expansion or amendment to take on this work. We've been really happy with the professionalism, competencies, and skill set of CARS, and would love to be able to continue working with them with this scope of work. So we are proposing that up to 1.5 million be used from BHSSA one-time administrative funds for that amendment. Okay. I'm just going to continue going through instead of focusing on the scope of work, but essentially it will convene subject matter experts. There will be some training modules that they will develop. They would work with state and local agencies to support the dissemination of the modules and identify additional needs for capacity building and training. So we've staff have really worked to flesh out this proposal, and happy to answer questions when I get to the end of the proposal or presentation. Okay, so we would, because these funds have to be encumbered by June 30th of 2026, we would aim to amend the CARS contract in early spring once we got approval at the full commission meeting, and so the project start date would be roughly May 1st, 2026, going through October 31st, 2027. Okay, the next part of the admin fund ask here is for substance use disorder services integration to better align BHSSA with Prop 1 to increase access to SUD services for school-age youth focused on those justice identified or justice involved youth. So again, this would be through an RFP to establish some pilots for SUD service integration with the delivery of school mental health services. We are requesting that we be able to use $3.6 million from the administrative fund bucket. Eligibility would be to fund up to 5 or 6 existing BHSSA partnerships to plan for and integrate substance use prevention and early intervention services to address the interconnected risk factors that drive SUDs in adolescents. We would plan to ensure geographic diversity and make awards to include small, medium, and large counties. The scope of work would include the following elements. So combining mental health and substance use education for an integrated approach to enhance mental health and substance use screening and early interventions that are coordinated and integrated, foster an integrated school climate that embraces the intersection of mental health and SUD, engage the community, including family partnerships and outreach, and then coordinate with California-wide existing efforts, funding streams, initiatives, and legislative mandates. So for this piece, the timeline, again, with an encumbrance deadline of June 30th, 2026, we would hope to have the motion pass today so that we could present this at the full commission meeting in January, and then be poised to release the RFP shortly after for an anticipated project start date of July 1, 2026, going through June 30th, 2028. All right, and then for the BHSSA evaluation funds, existing BHSSA law requires the Commission to develop metrics and a performance outcomes monitoring system for public reporting on the performance of services provided. The goal for use of these funds is to develop a comprehensive framework and tool to assess, track, and improve the quality, effectiveness, and sustainability of school behavioral health services. We would establish an RFP to support school behavioral health performance management systems to monitor implementation and measure outcomes. And I want to make, I apologize, but I need to make a verbal correction on the amount here. Where it says 5.1, it should say 9 million, which is the amount we have left in the evaluation bucket to encumber. So we will also be amending the motion, and then we'll amend the slide deck and repost so that it reflects my verbal correction here today. So this would look like funding performance management in up to 6 LEAs that participate in the BHSSA grant program, and we will also incorporate the geographic diversity there as well. The scope of work would be that these pilots would then help us plan for a scale up in the system so that it could be available for other districts and schools to really be a statewide instrument or metrics tool. So similar timeline as the SUD pilots, that we would develop the RFP upon approval by the full commission. We would develop an RFP to be released shortly after that approval in January, with an anticipated start date of July 1, 2026, going through July 30th, 2028. Okay, so just summarizing all of these, the dollar amount asks. On the administrative side, we are requesting $200,000 for grant management software, $1.5 million for to amend the existing TA contract with CARS to include TA for suicide prevention training, and then $3.6 million for SUD integration pilots. And then again, just making a correction on this slide for the evaluation component, this would be $9 million for the school behavioral health performance management systems. So with that, I will turn it back over to Chair Tsai to see if there are any comments from committee members.
Great, thank you, Melissa. So I'd like to invite committee members to offer any comments, questions. Marjorie, sorry, Commissioner Schwartz.
What's the connection? I'm addressing myself to the technical assistance suicide prevention training. The Department of Public Health already has a contract with CARS to provide technical assistance for student suicide prevention efforts. Have you looked at that, and is there overlap, or are we coordinating with that? What is the connection between the two, if any?
So I'm not familiar with CARS's contract with CDPH. However, this technical assistance component is connected to some legislation that will be discussed in the Legislative and External Affairs Committee this afternoon. So this is to really support efforts that are ongoing, and in alignment with, again, I'm not sure if it's CDPH's efforts, but efforts that are already in progress with providing training and support for schools and LEAs around suicide prevention. And I think Brenda is going to chime in.
I was just going to say, I was just going to see if yeah, can you say that, Kendra? I was just actually going to call.
Sorry, our Deputy of Legislation and External Affairs just confirmed that we have been in contact with CDPH. I apologize for misspeaking.
Thank you. I just want to make sure we're coordinating. I should have probably remembered the legislation. It's possible that you have one part of the role and they have another, from what I can see. Thank you.
Thank you, Commissioner Schwartz. Others? If not, and also just for the commissioners, we are going to have to vote on each of these separately. So there's a bit of a process, and thus the focus on time. And so with that, we'll transition over to public comment. We do appreciate you trying to keep your comments to 1 minute, please. Thank you. Stacy?
Thank you. At this time, members of the public may request to make a public comment on this item. There are currently no in-room comments. There are 3 comments virtually. Stacy Hiramoto, please go ahead and unmute yourself. Thank you.
Thank you. You know, when I read the legislative agenda, it was shocking to me that, there was very little discussion, and the only legislation they're proposing is this huge, again, suicide prevention concerning these same partners. And I'm not saying that this is what's happening. I'm just telling you from a public perspective, if you're not deeply involved, this just looks like the same kind of insider thing that the commission has been accused of in the past. I also feel that you should contract with people that have boards of directors that are diverse and have a reputation of serving BIPOC communities. I realize you got to get this money out the door by June. So I realize, but this just, again, lacks transparency to me. And I just wish we had more time to discuss it. Thank you.
Chair, I can't raise my hand, but can we have the staff? Sorry, I know I'm out of order, but are we aware, or the staff aware of what Stacy's saying? Or can we bring it back later to follow up?
Yeah, I mean, sorry, Rachel.
Order.
Greatlish. So I appreciate Stacy raising the concern and the thoughts, and I think we can still continue to think about it. I think it is that timing piece of it where there's just not a lot of time to go out for RFPs, and so trying to just think about everything that's on our radar, but trying to think about how we can better make sure that the work that we're doing is reflective of the communities and that we're engaging providers or contractors that have expertise in the areas that Stacy's raised.
And this is not illegal, but there's a former staff person from the commission that works there now. And again, that's not illegal. It's just, again, it just smacks of, if you know someone, I mean, these inside contact things. So that's all I want to say.
Not the intent, for sure. But appreciate you raising just all of this and talking about it. And the goal of putting all of this on the slide is to be transparent. So, that's what we're trying to do, is err on the side of putting information out there so that it at least provides the opportunity for us to all be aware and have these conversations.
No, it's wonderful. It's because you're right. In the past, they would not even have made this public. They would have just made the contract amendment. Thank you, Brenda. It is. But then I just have to say, okay, thank you.
Sorry for interrupting, Dr. Sai.
Thank you, Rochelle.
No problem.
Thank you. Next comment is Lisa Tadlock.
Hi, good morning. I am here representing myself and not my employer, just so that I'm clear that, but I do work in this behavioral health field. And I'm wondering, because when I see some of the opportunities here, and I think that they're great, and I understand the timeline on getting RFPs, but is there some sort of crosswalk? Because we just heard that there is, that CDPH is doing some suicide prevention, and like the California Youth Behavioral Health Initiative under DHCS is doing a lot of this work as well. And I see some, what I want to say is cross collaboration opportunities versus siloing, like some of the efforts that I know that the commission would like to meet. And so I'm just bringing it forward if there could be some sort of, I don't know. I mean, I just think of it as a crosswalk, and maybe there already is something already in existence on how these can collaborate and support each other, all of these different initiatives. And I'm looking specifically in the justice involved piece, but I know that there are other priorities as well. So I just wanted to put it out there that it'd really be helpful to kind of have some sort of crosswalk on what's happening currently to support the grantees in these same areas. That's it.
Thank you. We have one last comment for Allison Walensky.
Hi, my name is Allison Walensky. I'm with Long Beach Department of Health and Human Services, and I just wanted to echo, I think, the things that have already been said. It's a little bit confusing for those of us who have not been in these spaces, but who are following the all the stakeholder processes for BHSA, and having seen the phase 2 guidance come out from CDPH around really figuring out how to leverage all of these resources, including especially around suicide prevention and the funding that's going from counties back up to the state, specifically around suicide prevention. And I'm curious to see how folks can work to coordinate and with their new office for, I think it's social and behavioral health that is being created in 2026. So yes, again, just seeing how I'm very curious to understand a little bit better about how all of this is being integrated across as in rather than being rolled out in more silos.
And I just want to again apologize for being misleading about the Commission's collaboration with CDPH, because we do meet monthly with them on our various efforts. We take really seriously the mandate in Prop 1/BHSA to consult with both CDPH and DHCS on implementation of BHSA. This particular ask is related to providing technical assistance for the specific training for schools. So this is, I don't think, a siloed approach. This is really, the Commission is trying to look for how we can, through our BHSSA dollars, really support the ongoing work that CDPH is doing around suicide prevention, but specific to schools in this case.
Thank you. There are no more public comments.
Great, thank you, Claire. Okay, so we'll be entertaining multiple motion likes for the PAC committee to vote on. And Sandra, I think you're going to walk us through each of these, right?
Correct.
Yeah, I think
Correct.
if we get this.
I am looking at, and we'll put them in turn, the slides. So I'm not sure if Cody, who's putting the slides up. So we'll start with the first motion, a symbolic motion that the PAC committee recommends that the full commission approve adoption of to procure grant management software for an estimated $200,000. Do we have a first and a second? Hello, commissioners. And if you give me your last name when you motion, because I can't see. Cross move. Thank you, Commissioner Cross.
Second that motion, Fernandez.
Fernandez. Thank you so much. And if all commissioners can unmute their lines so that we can move speedily along. Commissioner Bear.
Aye.
Commissioner Burnick. Marking absent. Commissioner Chambers.
Aye.
Commissioner Cross.
Aye.
Commissioner Fernandez.
Aye.
Commissioner Designee Swartz.
Aye.
Committee Chair Sai.
Aye.
And I'm noting that Vice Chair Madrigal Weiss is abstaining. Motion passes. Now if we can have the next one. This is now entertaining a motion for the Program Advisory Committee to recommend that the full commission approve adoption to amend the BHSSA TA provider CARS contract number 24 MHSOAC 61 to provide an additional $1.5 million in BHSSA administrative funds for technical assistance for suicide prevention training. And please, do I have a motion and a second? And if you can identify yourself by last name.
I'll move.
Fernandez?
Sai, sorry.
Oh, Sai, sorry. If you can say your name when you so that I can.
I'll second the motion, Fernandez.
Fernandez, thank you. We have a motion and a second for this motion that's on the screen. Commissioner Bear.
Aye.
Commissioner Burnick. Marking absent. Commissioner Chambers.
Same.
Commissioner Cross.
Aye.
Commissioner Fernandez. Commissioner Fernandez.
Oh, aye. Sorry, I thought you.
Commissioner Designee Swartz.
Aye.
Committee Chair Sai.
Aye.
Committee Vice Chair Madrigal abstaining. Next motion If we can have it on the screen, thank you. The Program Advisory Committee recommend that the full commission approve adoption of the disbursement of $3.6 million in BHSSA administrative funds for substance use disorder services integrated pilots through a competitive RFP process. Do I have a motion and a second?
Schwartz moves.
Thank you.
Second, Bear.
Thank you. A motion and a second. Commissioner Bear.
Aye.
Commissioner Burnick. Marking absent. Commissioner Chambers.
Abstain.
Commissioner Cross.
Aye.
Commissioner Fernandez.
Aye.
Commissioner Designee Swartz.
Aye.
Committee Chair Sai.
Aye.
And Committee Vice Madrigal is abstaining. Motion passes. Now I think this is the final vote on this, yes. And this is the one where there's a correction. So I'm going to read it as corrected. The Program Advisory Committee recommends that the full commission approve adoption of the disbursement of $9 million. So that is a correction to the slide on where it says 5.1 million. That is a typo. It is $9 million in BHSSA evaluation for school behavioral health performance management systems through a competitive RFP process. Do we have a motion and a second?
Move, Sai.
Thank you, Commissioner Sai. Do I have a second?
Second, Bear.
Thank you. Motion and a second. Moving forward, Commissioner Bear.
Aye.
Commissioner Burnick. Noting absent. Commissioner Chambers.
Aye.
Commissioner Cross.
Aye.
Commissioner Fernandez.
Aye.
Commissioner Designee Swartz.
Aye.
Committee Chair Sai.
Aye.
Motion passes. Thank you so much.
Great. Thank you, Melissa, for your presentation. Thank you, Sandra, for walking us through that. Appreciate the comments. Clearly, we've heard the importance of coordinating, and I know the commission is meeting with CDPH already, and I'm sure we'll continue to do so, and I think we can find ways to communicate that to everyone. Okay, moving on to agenda item 7. This is a discussion and vote on the peer respite program. And also I'd like to invite co-chair Madrigal Rice to rejoin. Great.
She's here.
And I'll welcome Courtney Ackerman, research scientist of the Research Evaluation and Programs area, to hear about this contract.
Thank you, Commissioner Sai. And will we have the slides on the screen, or should I be sharing them, Claire? We've got them. Okay. Thank you so much. As Commissioner Sai noted, my name is Courtney Ackerman. I'm a research scientist with the Research Evaluation and Programs Division at the Commission, and I'm here to talk about the Peer Respite Project. Next slide. The goal today is to share the outline. One second. To share the outline for appropriating $20 million in Mental Health Wellness Act funds for peer respite. Next slide. As a refresher for any newer commissioners who may not know, California's Mental Health Wellness Act, or MHWA, grant program provides $20 million each year to improve community response to people facing behavioral health crises. These grants enable crisis responders to connect those in crisis with wellness, resiliency, and recovery-oriented programs that offer the least restrictive settings appropriate for their needs. Next slide, please. So the Commission has administered MHWA funds according to 6 priority areas. First, empath units that serve as alternatives to emergency departments for behavioral health crises, programming for older adults, including PEARLS and AgeWise, the 0 to 5 population through the maternal behavioral health and 0 to 5 grants, access to addiction services through a substance use disorder pilot program to increase access to medications for addiction treatment, technical assistance to build capacity and improve service delivery in county full service partnerships, and then finally today, peer respite. So next slide. On to the peer respite project. Next slide, please. So a peer respite is a temporary residence offering peer support services provided 24/7 in a home-like setting, staffed and operated entirely by peers. If you look around and talk to the people doing peer respite, the definition is a little bit fuzzy, but we're using the definition of a pure peer respite as defined by the national experts in this area. So peer respites are guided by the intentional peer support model, not the medical or clinical model. Stays are generally 7 to 14 days, with extensions possible up to 30 days. And peer support specialists are there to offer linkage to services, skill development, and general advice and support. Peer respites have been described by guests and staff as a place where people can go to pause or take a breath. This chance to take a break can give someone the space they need to rest and find community resources to help them function better in their daily life, rather than needing to be hospitalized. Next slide, please. For our project process, we were very committed to community engagement. This included interviews with over 40 experts, peer respite operators, county behavioral health staff, and peers, 7 site visits to peer respites operating in California, a literature review and landscape analysis, as well as communication with 58 out of the 59 California behavioral health jurisdictions, and communication with 11 peer-run organizations in California. Next slide, please. And about those site visits, we visited these 7 sites as part of our project process. These visits were really impactful for attendees, and Commissioner Chambers will probably speak to that. And they showed us just how much dedicated peers can do with very little. Each site provided the same warm welcome, support from empathetic staff, but each site did things just a little bit differently to meet their community's needs. Next slide, please. But meet them they did. Peer respites should be understood within the context of the larger behavioral health continuum. So they serve people who are struggling with severe mental illness, substance use, and or at the risk of homelessness, but they do more than that. They deliver cost-cutting outcomes by reducing hospitalization. They increase linkage to lower levels of care. They're really not standalone as well. They also act as an engagement tool for full service partnerships and other county offered care. And then finally, they employ peers via well-established guest to staff pipeline. Peer respites really do fill multiple gaps and meet needs, all at a lower cost and a less restrictive level of care. Next slide, please. So the peer respite model is promising, but uptake has been slow for a variety of reasons. First, peer respites are an emerging practice, and there is promising evidence, but with so few in operation, there isn't a strong research base yet. Second, some peer-run organizations, or PROs, don't have the capacity yet to bill Medi-Cal for services, which is likely to be the most sustainable funding structure for peer respites. Third, the absence of partnerships. Some county behavioral health departments have not built relationships with PROs in their community who can provide the kinds of services that a peer respite requires. And then finally, there is a knowledge gap. County behavioral health departments are largely not aware of the ins and outs of operating a peer respite or its potential for filling in the gaps. However, peer-run organizations in California have received a recent capacity boost through the PWI and EPIC grants through the Behavioral Health Workforce Development Initiative, and they're ready to tackle peer respite. California is currently making investments in peer respite infrastructure through the BCHIP grants, but infrastructure funding is not enough. We also need to scale up and disseminate best practices. Next slide, please. And through this project, we've learned some of the best practices for making peer respites run smoothly. Peer respites succeed when the environment is home-like and welcoming, when they're led and staffed entirely by peers, when they have strong ties with county behavioral health and other community-based organizations offering services, when they're governed by strong policies and procedures, when there's a system in place for collecting data and monitoring outcomes, and when they're sustained by braided long-term funding. Next slide, please. So now that we know how peer respites work best, this brings us to funding decisions. Next slide. For this funding, we are proposing a 2-phase funding outline. So the first phase will invest $10 million into establishing a pilot project and a learning collaborative that is focused on peer respite. Phase 2 will invest the remaining $10 million in funding into tailored funding for new and existing peer respites to meet their unique needs, along with supporting the continuing learning collaborative. And sorry, there is actually an error on this slide. Only the learning collaborative will continue into phase 2. The pilot project will have wrapped up by then. Next slide, please. So going into a little more detail on phase 1, the pilot project is going to bring together interested counties and a PRO in their community to work together. Technical assistance will be provided by the subject matter experts we contract with on partnership development, business planning, securing sustainable funding, and other best practices in peer respite. The Learning Collaborative will also be established, and it will be focused on establishing and sustaining a peer respite that is integrated into the behavioral health ecosystem. And then, of course, there will be research and evaluation that is paired with this phase. For timing, this is projected to be released in spring 2026, and the funding comes from the MHWA fiscal year 2025-26 funds. So that's $10 million that needs to be encumbered by June 30th, 2027 and expires June 30th, 2029. Next slide. And for a deeper dive into phase two will offer tailored funding to new and existing peer respites across the state to meet their unique needs. It will also see the Learning Collaborative continue, and of course, research and evaluation will continue to be paired with this step all along the way. As for timing, this is projected to be released in the spring of 2028. Hopefully, that tailored funding will be informed by the pilot project and the Learning Collaborative, and it will be funded with MHWA fiscal year 2026 to 27 funds. That's $10 million that will need to be encumbered by June 30th, 2028 and expires June 30th, 2030. Next slide, please. So before the full commission reviews this outline, this committee has a chance to consider it. So the discussion today should be focused on any questions committee members have or feedback on this funding outline. Next slide. And our next steps after the discussion will be to adjust the outline based on any feedback we received today and then present it to the full commission at the January commission meeting. Thank you. I'm going to hand it back to Commissioner Sy to facilitate discussion.
Thank you so much, Courtney. Okay, we have 8 minutes for discussion with commissioners and public. So appreciate us keeping comments succinct. We'll open it up to the committee members first. Comments, questions? Seeing none. Okay, Claire, moving forward with public comment.
Thank you. There are no comments in the room and no comments virtually.
Amazing. Bark.
Somehow we ended up being back on track. Thank you, everyone. I know we had to move fast today. A lot of symbolic votes.
We still have one commissioner, so let's.
Still have to
We have
move
what?
the line forward to the commission that we have to vote for that symbolic vote.
Oh yeah. Yes. Okay. Let's see. Do we have a motion? And a second.
Can identify your name, please. Who moved?
Cross.
Cross. Thank you, Commissioner Cross. Do you have a second?
I'll second.
Is that Commissioner Madrigal-Weiss?
It is.
Perfect. Thank you. We have the motion on the screen that the Program Advisory Committee recommends that the full commission approve the adoption of the MHWA Peer Respite Project outline. I will call the names out and please unmute your lines, commissioners, to be ready. Commissioner Baer.
Aye.
Commissioner Burnick. Marking absent. Commissioner Chambers.
Abstain.
Commissioner Cross.
Aye.
Commissioner Fernandez.
Aye.
Commissioner Designee Swartz.
Aye.
Commissioner Chair Sy. Committee Chair Sy.
Aye.
Committee Vice Chair Madrigal-Weiss.
Aye.
Motion symbolically passes. Thank you.
Great. Thank you, Sandra. Okay. Our final item is just the adjournment. I want to thank everyone, our committee members, our presenters today, the public who's joined in discussion. Thank you for joining. Our next full commission meeting will be over 2 days. Again, just another reminder to hold your calendars. January 22nd, as well as Friday, January 23rd in Sacramento. Information will be posted online in January. Our next Program Advisory Committee meeting will also be announced soon. So please do check back on our website. Thank you. Yes.
Sorry, just before you wrap up, want to make sure, because Commissioner Madrigal-Weiss just noted, did we need public comment on that vote, Sandra? I just want to make sure before we wrap up, because we had the vote and we did the roll call. Was there
I thought we did run public comment. Did I? Claire, did we miss public comment?
There was no public comment.
Yeah.
So
Yeah.
Do that again. Thank you. Good call.
Usually we do have public comment, so that was unique. Great. So thank you, everyone. Want to wish everyone a happy holiday, and we will see you next year.
Happy
See everyone
holidays.
next year.
Bye, everyone.
Thank you.
Thank you.